So, in my previous lecture, we started discussing the classification of bones based on development. Developmentally, bones are either they have membranous development, or they have cartilaginous development, or they have membrano-cartilaginous development. That is a combination of both membranous and cartilaginous. So, in my previous lecture, I discussed the membranous development. What happens in cartilaginous development? That there, first of all, a cartilaginous model is formed. The osteoprogenitor cells release both the osteoclasts, the bone resorbing cells, and the osteoblasts, the bone forming cells. The osteoclasts, they eat up the cartilaginous model, and the osteoblasts form new bone tissue, and that leads to the formation of eventually the final bony structure. So that is the cartilaginous development of bones. Now, the example of cartilaginous development is the bones of the face. Next is the membranocartilaginous development. What happens in membranocartilaginous is that it has a part of development is membranous and partly it is cartilaginous. So it is a combination of both. And its main example is mandible. Now we'll discuss the classification based upon shape and size or the morphological classification of bones. It has the long bones, the short bones, miniature long bones, flat bones, and the irregular bones. What are long bones? Long bone, this is an example of a long bone. It has a shaft and two ends. The shaft is also called the diaphysis. The expanded portion of the shaft is called the metaphysis, and the end is called the epiphysis. This is a typical structure of a long bone. The central structure of a long bone has a medullary cavity containing the bone marrow. The medullary cavity is lined by end ostium. And the central portion is the spongy bone. The surrounding hard bone is the compact bone, and the outermost covering of the compact bone is the periosteum. Examples of long bones are the femur, tibia, and fibula in the lower limb, humerus, radius, and ulna in the upper limb. The short bones are the carpal bones and the tarsal bones. Here is bony framework of hand. These colored bones are the carpal bones. They take part in the formation of the wrist joint. These are 8 in number and these are arranged in 2 rows. Miniature long bones are the bones that mimic the long bones and but they don't have all the features of the long bones. So these are the metacarpals and the metatarsals. Flat bones are the bones that are flat sheet-like, and the example of flat bones is this manubrium that we can see in this picture, this manubrium and sternum. This sternum is a flat bone. Another example is the bones of skull cap, and scapula is also a flat bone. Next is the irregular bone. Irregular bones are those that do not fit in any of the previous classifications that I have mentioned. Typical example of irregular bones is the hip bone and the mandible. Vertebra is also an example of irregular bones. Next classification is miscellaneous classification. In miscellaneous classification, first bone that we'll discuss is the sesamoid bone. Sesamoid bone is a bone that develops in a tendon or a muscle. Patella here that we can see is the largest sesamoid bone and it develops in the muscle of quadriceps femoris tendon. Pneumatic bones are those bones that have empty spaces inside them. This is structure of spongy bone and here we have spaces inside. In this picture, the paranasal air sinuses are what are paranasal air sinuses? They are the spaces inside bones that make the skull light. For example, here we can see this is frontal air sinus. This is empty space or sinus inside the frontal bone. This is maxillary sinus. This is empty space inside the maxilla. So these bones make the skull lighter. So examples of the pneumatic bones are the maxillary, the sphenoidal, the ethmoidal, and the frontal bone. Now, wormian bones are worm-like structure, worm-like bones that are lying in the course of a suture. Here we can see this is a sagittal suture and this is the lambdoid suture. So this is a wormian bone that is being formed in the course of the sagittal suture. They are worm-like, so hence the name wormian bones. Supernumerary bones are additional bones. They are not normally present, but they can be present. Here we can see there is a rib above the first rib, and it is called anomalous first rib or the cervical rib. Heterotropic bones are the bones that are not present by birth, but they develop due to strenuous exercise. For example, riders' bones are formed in the adductor muscles. The structure of a long bone is that it has a shaft or the diaphysis, expanded portion of the shaft or the metaphysis, and the end, that is the epiphysis. What is osteogenesis? Osteogenesis is the development of new bone. Bones are formed from primary and secondary ossification centers. The primary ossification center develops during 5 to 15 weeks of intrauterine life, and primary center leads to the development of the diaphysis and the metaphysis. The secondary ossification center appears to form the epiphysis. So the primary center makes the diaphysis and the metaphysis, and secondary center forms the epiphysis. Now there are different types of epiphysis. First of all is the pressure epiphysis. What is pressure epiphysis? It is an epiphysis or an end of a bone that is developed due to push of the adjacent bone at the site of a joint. So here we, and this is an articulated end. So all the pressure epiphyses are articulated ends of the bones. For example, this is head of femur and it takes part in the formation of the hip joint. So this part is due to the pressure epiphysis. Next is traction epiphysis. Traction epiphysis is due to traction or pull of the muscle. For example, this upper end of the femur has a greater trochanter and a lesser trochanter. These are formed due to pull or traction of muscles, hence the name traction epiphysis. Next is the aberrant epiphysis. It is an epiphysis that is unusual and it may not always be present. For example, in the head of the metacarpal bones or in the base of the metacarpal bones. Atavistic epiphysis is that some bones have two or more than two primary centers of ossification, which give rise to individual bones, which later on fuse. For example, temporal bone is eventually a complete bone that is further formed by a squamous part, a petrous part, a tympanic part, and a styloid part. So the entire temporal bone has four parts that were individual bones, but they eventually fused to form a single temporal bone. Next is growing end hypothesis. What is growing end hypothesis? That the growing end of a long bone is formed due to an epiphysis. Now, a bone has two epiphyses, an upper end or and a lower end. Now, the secondary center of ossification for one of the either ends is formed earlier than the other. So, in long bones, the growth cartilages are two in number and the growth takes place at both ends. The growth is relatively more at one end and then the other due to different growth pattern. So at such end where the growth plate, the secondary ossification center arises earlier, it fuses late, or this is the end that continues to grow later on. So there are two laws of ossification. First is that the epiphysis first to appear is last to fuse. So hence that is the growing end, and this is vice versa except for fibula. So fibula is an exception to this rule. Now another fact is that the nutrient canal is always directed away from the growing end, and then again fibula is an exception. Hence, in the upper limb, we can see that the growing ends of the long bones are present at their ends situated away from the upper elbow joint. That is, the upper end of humerus and the lower ends of radius and ulna are the growing ends. So, neutral canals are directed towards the elbow joint. Lower limb has an opposite pattern. In lower limb, the growing ends of the long bones are present towards their ends forming the knee joint. So the lower end of femur and upper end of tibia and fibula are the growing ends. Hence, the nutrient canals are directed towards their ends which are present away from the knee joint. This is a very interesting mnemonic to remember this fact. The growing end is, if growing end is towards the left side, the nutrient canal is directed towards the right side. So towards the elbow I flow. Yeah, that means that the nutrient canal is directed towards the elbow in the upper limb, Away from the knee, I flee. So the nutrient canal is directed away from the knee in the lower limb. Blood supply of bones is very important. A mature long bone is supplied by four arteries. These are the nutrient arteries, the periosteal arteries, the metaphyseal arteries, and the epiphyseal arteries. The nutrient artery is an artery of a branch of a major vessel that is supplying that area. The nutrient artery enters through the nutrient canal, enters the medullary cavity, and it is divided into ascending and descending cortical and central branches. These branches give off further branches as it reaches the metaphysis, and it anastomoses with metaphyseal arteries and the epiphyseal arteries. Next are the periosteal arteries. These are the arteries which are present in the muscles that are attached to the periosteum, and they anastomose with branches of the diaphyseal arteries. The metaphyseal arteries arise from neighboring and periosteal arteries, and they anastomose with branches of the epiphyseal and diaphyseal arteries. Finally, we have the epiphyseal arteries. These arteries arise from the anastomosis around the joints. This is an important thing. The epiphyseal arteries are from the anastomosis around the joints, and they form periarticular vascular arcades which supply the epiphyseal ends. And they also anastomose with diaphyseal as well as metaphyseal arteries. Now, what is growth cartilage? The growth cartilage, I told you earlier, is a cartilage that is on the growing end of a long bone. Its blood supplies to the epiphyseal, metaphyseal, as well as periosteal arteries. So, what is a fracture? Fracture is of two types. It can be a closed or simple fracture, or it can be an open or compound fracture. A closed fracture is one in which the flesh is not disrupted, the continuity of the skin is not disrupted, and it is a closed fracture. In open fracture, the muscle mass and the muscle mass is disrupted, and we can see an open wound. Healing is a process in which once a bone is broken, it is healed. And the process is that first of all, a clot is formed. In the clot, the osteoprogenitor cells, the fibroblasts and capillaries form. They lead to the formation of a fibrous structure or the granulation tissue. In the granulation tissue, the osteoprogenitor cells give rise to chondroblasts, which leads to the formation of a fibrocartilaginous callus. Then what happens that the osteoprogenitor cells give rise to osteoblasts that osteoblasts and osteoclasts. The osteoclasts resorb the cartilaginous structure, and the osteoblasts form the bone. It replaces the cartilage and forms the bony callus. And eventually, the mature bone is formed. That's all for today. I hope you understand all of this very clearly now.